Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-parole aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'honorable Dorothy Shephard, ministre de la Santé. Speaking on behalf of the province today, Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dorothy Shephard, Minister of Health. Dr. Russell.
Thank you, Bruce. Merci. Bon après-midi à tous et à toutes. À toutes et à tous. Good afternoon, everyone. En dressant une feuille de route pour permettre au Nouveau-Brunswick d'atteindre la phase d'alerte verte de notre plan de rétablissement, nous avons redonné espoir à l'ensemble de la population du Nouveau-Brunswick. Nous avons maintenant le défi de transformer cet espoir en gestes concrets. Au cours des semaines à venir, nous accélérons encore davantage nos efforts visant à protéger les citoyens du Nouveau-Brunswick contre la COVID-19. Already, nearly 2/3 of New Brunswickers have received at least one dose of COVID-19 vaccine. That's a tremendous accomplishment. But we must do more. We will use every tool at our disposal to increase our vaccination rate, but we will need your help to get us to green. There are approximately 45% of appointments through June 7th currently unbooked at our RHA clinics. So this is your call to arms. We need your arms to fill those clinics. Si vous n'avez toujours pas reçu votre première dose du vaccin contre la COVID-19, prenez rendez-vous dès aujourd'hui. In the early days of our vaccine campaign, thousands of New Brunswickers received the Astrazeneca vaccine for their first dose. Due to emerging scientific evidence, we have since changed the way we use this product in our vaccine campaign. We continue to use the Astrazeneca product, but only in those for those of the age of 55 and over, and for New Brunswickers who are not physically able to receive a shot at an RHA clinic or pharmacy. I know that those who received AstraZeneca as a first dose, particularly those who were under 55, have been wondering what they can do for their second dose. Lots of questions on that. Quand viendra le temps de recevoir votre deuxième dose, vous pourrez recevoir un vaccin à base d'ARNM produit par Pfizer ou Moderna, soit le genre qui constitue la grande majorité de notre approvisionnement de vaccins que nous utilisons. En se fondant sur des études récemment menées en Europe, le Comité consultatif national sur l'immunisation juge maintenant qu'il est sécuritaire et efficace d'administrer une deuxième dose d'un autre vaccin contre la COVID-19. When the time comes for your second dose, you will be able to receive an mRNA vaccine manufactured by either Pfizer or Moderna, which make up the vast majority of the vaccine supply that we are using here in New Brunswick, but also in the rest of Canada. New advice from the National Advisory Council on Immunization, NACI, based on recent studies in Europe, suggests that providing a second dose from another product is safe and effective against COVID-19. This new advice suggests that these vaccines are interchangeable without loss of effectiveness. This will give us the flexibility to provide more options in providing the second dose, which provides maximum protection against the COVID-19 virus. So we are really anxious to get everybody vaccinated with 2 doses. Those over 55 who received AstraZeneca as their first dose, and if the minimum of 8 weeks have passed, then they can book a second dose of AstraZeneca now or choose an mRNA vaccine when second dose clinics open up. Information for all New Brunswickers on receiving a second dose of vaccine is expected next week. So in the meantime, we are making great strides of getting to that target of 75% for first doses, but we do need all hands on deck, all arms on deck. While we are making great strides as well with respect to case numbers and hospitalizations, COVID-19 will still be with us for some time to come. Aujourd'hui, Santé publique confirme qu'il y a 12 nouveaux cas de COVID-19 au Nouveau-Brunswick. Il y a 3 nouveaux cas dans la zone 1, soit la région de Moncton du sud-est du Nouveau-Brunswick. Toutes ces personnes ont eu des contacts avec des cas confirmés auparavant. Dans la zone 2, qui comprend les comtés de Saint John, Kings et Charlotte, il y a un nouveau cas qui est directement lié à un voyage à l'extérieur de la province. Dans la zone 3, soit la région de Fredericton et de la vallée de la rivière Saint-Jean, il y a 4 nouveaux cas. Un de ces cas est un contact d'un cas déjà confirmé, alors que les 3 autres font toujours l'objet d'une enquête. Dans la zone 6, soit les régions de Bathurst et de la péninsule acadienne, il y a 4 nouveaux cas, tous les contacts avec des cas déjà confirmés. Today, Public Health has confirmed 12 new cases of COVID-19 in New Brunswick. In Zone 1, which is Moncton and southeast New Brunswick, there are 3 new cases. These are all contacts of previously confirmed cases. In Zone 2, which is St. John, Charlotte, and Kings County, there is 1 new case which is directly related to travel outside the province. In Zone 3, which is Fredericton and the St. John River Valley, there are 4 new cases today. One of these is a contact of an existing case, and the others are under investigation. In Zone 6, which is Bathurst and the Acadian Peninsula, there are 4 new cases, all of which are contacts of previously confirmed cases. There are now 140 active cases of COVID-19. This includes 6 New Brunswickers who were infected outside of the province and are self-isolating there. There are 7 New Brunswickers now hospitalized due to COVID-19, including 2 who are under intensive care. One of these individuals is currently in a hospital outside of the province. All of these people need our care and support. And again, I do ask that you keep them in your thoughts and prayers as you go about your day. And I do understand how tired everyone is of COVID-19 and this pandemic. It is really difficult to maintain this restricted existence, especially when we are so close to the end of this journey in the last phase. But there aren't any shortcuts to our destination. Pour nous rendre au point où il sera possible d'éliminer ces restrictions, nous devons, pour le moment, suivre les consignes au pied de la lettre. Pour réussir à repousser la COVID-19 pendant que nous vaccinons nos citoyens, nous devons tous continuer à porter un masque en public et à nous maintenir à au moins 2 mètres des autres. To keep COVID-19 at bay while we get our people vaccinated, we must all continue to wear a mask in public places and maintain 2 meters of physical distance from others. We must all continue to wash our hands regularly and thoroughly and use an alcohol-based hand sanitizer between washings. We must all stay home from work or school when we feel unwell. And we must watch for symptoms of COVID-19 in ourselves and our families and seek testing when symptoms emerge. But most of all, everyone must get vaccinated. And every New Brunswicker wants to see the threat of COVID-19 reduced in our province, but this virus won't magically disappear on its own. If we want to put this behind us, we all need to take action now. So please don't wait for a miracle to get us back to a normal life. Be the miracle. Thank you very much.
Good afternoon. Bonjour. Last week, we announced the 3 phases in our path to green in our COVID-19 recovery plan. I know everyone was very excited to learn we are on track to reopening our province and enjoying freedoms and activities that have not been permitted for several months. Since then, we have continued to make excellent progress in our vaccine campaign. As of today, 64.5% of New Brunswickers aged 12 and older have received at least 1 dose of the vaccine. This is great news, and we should all be proud of what we've accomplished together. We are making great strides in vaccinating our population and moving toward a life with fewer restrictions. And while this is an impressive number, if we want to hit our first goal and move into the first phase on our path to green by next Monday, June 7th, we all need to contribute by rolling up our sleeves. To enter the first phase, 75% of New Brunswickers aged 12 and older must receive their first dose of the vaccine. Hospitalizations must also remain low, and all health zones must remain at the yellow alert. If we can achieve those targets as early as next Monday, we would be able to enter phase 1. In this phase, people traveling from Prince Edward Island, Newfoundland and Labrador, Avignon, Temiscudata, we will be able to come to New Brunswick without needing to isolate. Cross-border commuters and truck drivers will no longer be subject to testing and isolation requirements. Other workers, including rotational workers, people moving to New Brunswick, and people traveling to the province from outside PEI, Newfoundland, Avignon, and Teremscuda, will still need to self-isolate away from others upon arrival. However, the amount of time they must spend in isolation may be reduced. They will be tested between days 5 and 7 and can leave isolation if they have a negative test, unless they are under an existing work isolation plan. Compassionate travel to New Brunswick will be permitted for people traveling from outside those regions with isolation and testing requirements in place. Under Phase 1, we will be able to have contact with all our family and friends and will no longer have to limit our contacts to a steady 15. Informal indoor gatherings of 20 people or fewer will be permitted, as well as formal indoor gatherings at 50% or less of venue's capacity with an operational plan in place. Informal outdoor gatherings will be allowed to take place as long as separate groups maintain 2 meters of physical distance, and formal outdoor gatherings can be held up to a venue's maximum capacity as long as physical distancing is observed and an operational plan is in place. Organized sporting activity will be permitted with an operational plan, and games and competitions will be allowed with teams based in PEI, Newfoundland, Avignon, and Teremscuda. Faith gatherings will be able to take place with an operational plan as long as the venue is at 50% capacity or less, and the choir is at least 4 meters away from the congregation. We are on the cusp of taking this first big step towards our green level. We have the doses we need to ensure 75% of New Brunswickers receive their first dose. We have appointments available through Horizon and Vitalite Health Network clinics and participating pharmacies in all regions of the province. I know this is a lofty goal, but if we want to take this first step, this is what we need to do it as soon as we can. Achieving our target by June 7th is possible, but we are depending on you to help us get there. Throughout the pandemic, we have relied on New Brunswickers to step up and play their role in slowing the spread. You have done an incredible job so far. You have followed public health guidelines, and you have worn a mask in public spaces. You've gotten tested when you had symptoms or faced a potential exposure to the virus. Now we need you to do one more thing. We need you to get vaccinated. Please get vaccinated to protect yourself and your family. Do it to protect the vulnerable residents who face life-threatening consequences if they come in contact with COVID-19. Get vaccinated so we can all reunite with the people we miss and return to the activities we miss. Just imagine what this summer could look like if every New Brunswicker does their part. We could all enjoy warm days, spend with loved ones who we haven't been able to hug for more than a year. Many of the activities we once took for granted could be possible once again, sooner than we ever imagined. We will be able to further loosen restrictions by July 1st, Canada Day, as long as we continue to hit our vaccination targets and 20% of people 60 and older have received both doses of the vaccine. As early as August the 2nd, New Brunswick Day, we will be able to remove the mandatory order and lift all restrictions as long as 75% of all New Brunswickers 12 and older have received 2 doses of the vaccine. It is possible for us to reach both of these goals as well, but again, we need New Brunswickers to continue to step up and get vaccinated to make it happen. Over the last year, we have all had to miss out on so much. We've made sacrifices for the greater good, and now we are all impatient to get back to a more normal life. Let's not delay any longer than we need to. If you have been waiting for the right time to get vaccinated, the right time is now. If you have not yet done so, visit www.gnb.ca/book-a-vaccine to find a vaccination appointment. If you have family members, friends, and neighbors who have not yet been vaccinated, let them know the appointments are available and that the process is quick and simple. We are so close. We can do this. We just need to continue to work together to take our first step forward on that path to green. Thank you very much. Merci.
Thank you, Minister. Thank you, Dr. Russell. Merci beaucoup à vous deux. Thank you both. On va maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura une question et un suivi très rapide. Voulez-vous assurer de désactiver le son de vos micros? Folks, we'll now proceed with questions from members of the media. Each reporter will have one question and a very quick follow-up. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Marie-Ève Brassard, Radio-Canada. Moving on, Vicky Hogarth, CHCO-TV.
Thank you, Bruce. Dr. Russell, as we move towards reopening, how do you anticipate this affecting New Brunswickers under 12, especially with variants at play? Do you expect the herd immunity we anticipate to protect them, or will a large number of them likely contract the virus?
Great question. Throughout the pandemic, we look to other jurisdictions for a lot of our information and studies and research and data, but we also have great data internally here in New Brunswick. With every outbreak that we've had, again, we collect data on all of the components of the outbreaks, from the variant that's infecting people to the doses of vaccine on board, the age breakdown, whether they're symptomatic or not, whether they're hospitalized or not. So we'll continue to collect that information, and if we see trends that increase risks for that population, then again, our strategy all along is always to identify our risks and then try to mitigate them as best we can, as strategically as we can, and trying to do that in a way that's evidence-based.
Thank you, Doctor. Ms. Hogarth, do you have a follow-up today?
Yes, thank you. Do you know how close we are to potentially making the vaccine available to an even younger demographic below the age of 12?
I don't have information on that right now.
Thank you both. Laura Brown, CTV.
Hi there. I heard from a family who has a loved one at Ridgewood that Ridgewood long-term care home facility has yet to get their second dose, despite us being told second doses were all given to long-term care homes last week. It is a Horizon-run facility. I'm wondering if that has anything to do with it.
It might very well, but thank you for the question, and we will certainly look into that this afternoon to get an answer and to understand when that will happen.
Ms. Brown, do you have a follow-up?
Yeah, we're looking at 2% every day until Monday that we need to get vaccinated. I know that sometimes, pharmacists don't get the data in the day of the vaccine. Like, how confident are you at this point that we'll actually reach that threshold? And if we don't, what happens?
I think we're quite confident. There's there's data that we are still inputting, and we don't see a resistance. So I think this is a matter of just ensuring that people understand that we have this lofty goal that we think is extremely achievable, and encourage everyone to make the time. We often say in St. John, everyone's a last minute attending any event. So I'm just going to, I'm going to be very confident that we're going to reach our goal of 75 and look at it on Monday.
Dr. Russell will add.
So everything that needs to be put in place to achieve that goal is there, and as we get closer, again, it's really going to be up to the entire population of New Brunswick to do their part. So we are on this quest. We're we're going to drive to 75, so we want you to get on board and book all those appointments between now and Monday.
I like that. Drive to 75.
Thank you both. Tim Roselle, Global TV. Tim Roselle.
Hello?
Hello.
Can you hear me now?
Perfectly.
Oh, great. Sorry about that. My question is for Dr. Russell. And Dr. Russell, I'm wondering if you can talk about the note that Horizon put out yesterday about people that may have booked more than one appointment for a vaccine and maybe aren't canceling them. Can you talk about or characterize how big of an issue this booking of multiple appointments and maybe not canceling one, people no showing for appointments? Can you characterize how big of an issue that is right now and maybe what's being done to mitigate it?
Well, I'll just start by saying brownie points, bonus points for being enthusiastic. That obviously is a very enthusiastic group of people who are doing multiple bookings to try to get in as quickly as they can. Certainly from an efficiency perspective, it would be better if people either only made one appointment or if they were canceling, if they did make multiple appointments to cancel. That actually would make Horizon staff's life better. So in terms of efficiency, in terms of really helping us get to that goal by June 7th, I think we're aiming for midnight, June 7th. So I think they're going to be offering longer hours in some of the clinics to be able to accomplish that. So whatever time of day you can get in there, get her done.
Just to clarify though, Dr. Russell, do you feel as though this is an issue right now?
Well, I think if Horizon is involved in communicating to folks around that, then they obviously do consider it an issue. And again, our job is to make sure that we're doing things as efficiently and effectively as possible. So redirecting the public's efforts and energy and enthusiasm to just continue being aligned that way would be very helpful. And we are all promoting all the clinics on social media. So Vitalité, Horizon, any of the pharmacies, et cetera. So we're really trying to piggyback on each other's messaging. Again, just to make sure that we get all first doses in as soon as possible.
Tim, do you have a follow-up?
Yes, very quickly for Minister Shephard, excuse me. Minister Shephard, if for whatever reason New Brunswick doesn't hit that 75% goal on Monday, does that move the other phase dates as well, or can you address that?
Not necessarily, because I think second doses will certainly follow suit once we reach that 75%. So the goal is 75% for Monday. It is, we're pulling out all the stops to try to make that happen and to encourage people and to help them get to the clinics they need to get to. I don't think that would move the needle on the other dates. We are being ambitious, and we know that New Brunswickers want to get back to enjoying their family and friends on a regular basis. And so I think we'll be fine.
Thank you both.
Thank you.
Marie-Ève Brassard.
Oui, bonjour. Ma question est pour Dr. Russell. Dr. Russell, le premier ministre Glenn Hicks a fait des déclarations ce matin. Il a mentionné la possibilité de comptabiliser les Néo-Brunswickois qui sont à l'extérieur du Nouveau-Brunswick actuellement pour atteindre la cible de 75 %. Est-ce que la santé publique appuie ce genre de calcul-là? Est-ce que ça fausserait pas un peu les données de considérer les Néo-Brunswickois qui sont à l'extérieur de la province actuellement?
J'ai pas compris tout ce que vous avez demandé, mais ce que j'avais compris, c'est que vous voulez savoir si nous voulons avoir l'information sur les gens qui se sont fait vacciner en hors du Nouveau-Brunswick, mais ils sont des Néo-Brunswickois.
Oui, c'est dans le sens de savoir s'ils vont être comptés dans le calcul pour atteindre les 75 % de Néo-Brunswickois vaccinés.
I'm going to take that one for Dr. Russell. So as you know, many New Brunswickers and people from all of Atlantic Canada sometimes spend a few months outside of our province during the winter months. We know that individuals who have been away many of them, received their vaccinations outside of the province, but they're back in New Brunswick now. And so if they have been vaccinated outside the province, we do need to include them in our numbers so that we're having an accurate reflection of all of those New Brunswickers 12 years of age and older who are vaccinated. We will be, just to add to that, we will be having a process for that, and we'll be able to have details in the next day or so.
Mademoiselle Brassard, as-tu un suivi?
Oui, merci, ministre Shephard. Donc, mon suivi serait avec Dr. Russell. Vous avez mentionné un peu plus tôt qu'il y avait 45% des rendez-vous qui étaient disponibles encore pour jusqu'au 7 juin. Je voulais juste confirmer avec vous que c'était bien les rendez-vous dans les cliniques d'Horizon et de Vitalité et est-ce que ça prend en considération les rendez-vous disponibles dans les pharmacies?
Non, c'est seulement ceux avec les réseaux.
Parfait, merci.
Merci à vous deux. Tom Bateman, Brunswick News.
Good afternoon. Dr. Russell, will New Brunswick follow the World Health Organization's advice around the naming of COVID-19 variants according to the Greek alphabet?
You're talking about the nomenclature in terms of, B117, B...
Yeah, Delta, Alpha, etc. It seems like a simple way to avoid, some of the complications we've seen with keeping track of everything.
You mean in terms of communicating with the public or in terms of our surveillance?
Perhaps both.
Yeah, so internally we use the different nomenclatures that are assigned by the World Health Organization in terms of the variants of concern and variants of interest. I think for the public, we definitely would like to adopt that language for identifying the nomenclature in terms of the number first, and then first identified in, because it is difficult for the public to memorize all of those numbers, and I find it it does simplify things, but we will review and consider it. But I try to use both, but it's not always consistent. But internally we definitely our documentation and surveillance refers to the nomenclature for each variant.
Mr. Bateman,
Okay, perhaps I wasn't clear. Yeah, just on that. I think the World Health Organization is suggesting we assign like Greek alphabet letters.
Oh, sorry. No,
specific.
I didn't. I had read something about that, but I did not realize that was coming from the World Health Organization. My apologies.
No problem.
So
will we kind of adopt that strategy as well?
I think, Tom, I can certainly let you know that we will consider that. There's never been any intent on certainly our jurisdiction, government, province. I don't believe anyone in Canada wants to stigmatize, any particular illness in regards to COVID-19. So absolutely, I'm sure we'll give that consideration.
Tom, quick follow-up.
Yes, thank you both. I just wonder if there's an update on the circumstance around the community transmission in the Fredericton area. Have we resolved that? Is it still a situation where there are cases that haven't been tied to existing clusters in that region?
Well, we make progress every couple of days. As you know, with previous outbreaks, sometimes it takes several weeks to identify the sources. So we still are investigating, and my goodness, we have a dedicated team of staff and epidemiologists and medical officers and public health nurses. It's like a CSI investigation, and they really dig deep, and they will go back and interview people repeatedly to get information that might have been missed on the first interview or the second interview or the third interview. They're quite persistent, but it does take time.
Okay, are there unresolved cases still within?
Pardon me?
So are there still cases that don't have a link to other cases?
I will have to check on that. I know one of the recent ones, they just found a link, so I would have to check on that, but I know there was one in particular that they recently did find a link.
Thank you.
Thank you both. Bobby Jean McKinnon, CBC.
Yes, thank you. Dr. Russell, can you hear me?
Yes.
Okay. The Premier has said the province is looking to count snowbirds and other residents who have been vaccinated outside the province toward its 75% vaccination goal, even if they're not currently physically in the province. But isn't the whole point of the 75% target herd immunity? So I'm just hoping you can comment, on whether counting those people who are outside the province, whether that would distort or have an impact on that.
So I'm going to take that one, Bobby Jean. Thank you. It's my understanding that we are targeting data so that will confirm those who have been out of province and received vaccination out of province and have come back to the province. We want to confirm data to include those individuals in our numbers. It's important to us that it be 75% of our population here in the province that is vaccinated or currently living in the province. I think that might clarify that for you.
Ms. McKinnon, follow up?
Yes, thank you. Dr. Russell, given that people who got AstraZeneca as their first dose can now safely choose which vaccine they want to choose as their second, how concerned are you about the province's stock of AstraZeneca going to waste, and what is the current stock, please?
I don't have the current stock numbers in front of me, but I can tell you that it's difficult to predict at this point what people will choose, but we just wanted to make people aware that they can choose, and we'll just have to see how things unfold, and we'll keep an eye on that, and we'll have more information. But as of right now, I don't have the exact numbers in front of me, but I can get them for you.
Erica Butler, CHMA.
Hi there. Can you hear me okay? Okay. I guess for Minister Shephard, I am wondering, is there any chance you will be considering including either Cumberland County or all of Nova Scotia in the phase 1 changes due to happen on June 7th? Or whenever it is we achieve the 75% of first shots? I guess, are the details of what you announced last week set in stone, or will you be making the call based on the situation at the time on Monday?
Well, I think that we have set our targets for Monday, June 7th. And I won't say that we would never go back and revisit something, because quite frankly, all through COVID, we have had to pivot in real time many times. Right now, we've established that the bubble would be, our New Brunswick with our two Quebec communities, but that's always subject to be reevaluated on a daily basis.
Do you have a follow-up, Erica?
Yeah, I was wondering, I'm not sure who would speak to this, but can you talk a bit about the decision to sort of frame the vaccination rollout numbers in New Brunswick in terms of like the percentage of people 12 and over? It seems that across Canada, it's a percentage of population, so our numbers aren't immediately comparable. Can you talk a bit about that? Because, I mean, obviously, my impression is that, coronavirus doesn't really care if you're 12 and over, although I understand we only have people eligible who are 12 and over.
I'll take that one. Before I answer that one, though, I did want to come back to the question about how many doses of AstraZeneca we have. On Wednesday, May 19th, we had 13,500 doses of AstraZeneca that arrived, and then we did get another 100 doses on May 4th. Currently, we have 4,000 doses of AstraZeneca, and the AstraZeneca doses available right now were for use by May 31st, but we did actually get a review of the batch's stability, so Health Canada did extend that expiration date to July 1st. So in New Brunswick, again, that's what we've just got right now. And now coming back to your question, It was my understanding that all provinces were reporting the percentage of population vaccinated based on the eligibility. So I'm not aware that there are provinces who are not reporting that way, and I would have to look into that.
Thank you. Andrew Waugh, Brunswick News.
Yeah, just a question on the vaccine clinic vacancies. I might have heard this wrong, but I thought it was said.
Andrew, can you speak a bit louder, please?
Can you the volume up?
Yeah, can you hear me now?
Perfectly, thank you.
Okay. I might have misheard this, but I think I heard 45% of clinics at the RHAs have vacancies up to Monday. If I'm correct, how concerning is that? And is that the highest it's been since the vaccine push started? Are we seeing vaccine hesitancy here?
Oh, no, my goodness. I think it's just because we've actually added new clinics. So as the new clinics are added, there's more spots. So we're just letting you know how many are vacant right now and get signed up. Go make an appointment.
Mr. Waugh, follow up?
Yeah. With the Astrazeneca, is there no risk in, I mean, I get it, Health Canada's extended the expiry date, but given the amount of vaccines we have from Pfizer and Moderna, and given that 2 New Brunswickers have died, why not just stop putting AstraZeneca shots in people's arms, particularly now they've said, yeah, mix and match is fine?
Yeah, I hear what you're saying, Andrew, but we really take the advice of NACI very seriously. So the National Advisory Committee on Immunizations works very diligently to provide the risk assessments for us. And then each Chief Medical Officer of Health and their public health teams within each jurisdiction take that advice and apply it based on epidemiology and unique situations within each jurisdiction. And I believe Minister Shephard has something to add to that.
I just wanted to add that we have many people who have received their first dose of AZ who want their second dose. So that it has always been an option, and that option will remain.
Thank you, Mr. Waugh. Cédric Thévin, Acadie Nouvelle.
Oui, j'aimerais savoir si on devait recevoir des doses des États-Unis, des doses excédentaires des États-Unis pour atteindre nos cibles de vaccination plutôt que prévu. J'aimerais une mise à jour à ce propos-là.
Yeah, I'm going to just take a stab at this and let you know that, I mean, we're always in talks, especially at the Premier's level, with other jurisdictions, and with regards to anything that could come out of the United States would certainly be arranged, collaborated with the federal government. So I would have to defer any real specifics to that question to the Premier's office.
Merci. Monsieur Thévin, as-tu un suivi?
Oui, une question pour Madame Shephard. Est-ce que vous savez comment vous allez permettre aux infirmières des hôpitaux de Moncton d'avoir des vacances cet été?
Yes, thank you for that question. We have been working diligently with the RHAs and the Nurses Union. They had another meeting yesterday morning. There's been some follow-up communications with regards to clarifying some information. Recommendations have not come forward just yet, but we know that we want our nurses to have some respite over the summer holidays. They deserve it, and we will be working diligently with them and the RHAs to ensure that that happens.
Merci. Alex Villeneuve, Radio-Canada.
Bonjour, Madame Russell. Avec le nombre d'expositions potentielles qu'on a annoncé dans les derniers 24 heures dans la péninsule acadienne, est-ce que la situation vous inquiète?
Alex, peux-tu parler un peu plus fort?
Oui, avec le nombre d'expositions potentielles qu'on a annoncé dans les derniers 24 heures dans la péninsule acadienne, Madame Russell, j'aimerais savoir si la situation dans la péninsule vous inquiète.
Alors, je comprends votre question très bien et je comprends les inquiétudes des gens pour être en train de ressentir à ce moment-ci parce qu'on n'a pas vraiment vu des nombres comme ceci dans la zone 6 avant. Moi, j'ai des réunions chaque jour avec les médecins hygiénistes pour les régions et on fait les suivis avec les protocoles. On fait le traçage de contacts étroits. Alors, il y a des infirmières de santé publique qui travaillent tellement fort à ce moment-ci et ils nous donnent les informations chaque jour au sujet des risques et qu'est-ce qu'on devrait faire pour protéger la population. Alors, à ce moment-ci, toutes les choses qui se passent à ce moment-ci au niveau de tous les protocoles de santé publique, c'est ça qui se fait maintenant.
Monsieur Villeneuve, as-tu un suivi?
Oui, c'est concernant ce que Mme Shephard a expliqué tout à l'heure. OK, on a expliqué qu'elle voulait prendre en considération les snowbirds à l'extérieur de la province dans le calcul du pourcentage de la population vaccinée. Mais j'aimerais savoir, Mme Russell, est-ce que c'est un calcul qui est approuvé par la santé publique? Et j'aimerais avoir aussi, si possible, une réponse en français là-dessus.
Bien, je pourrais commencer, mais ça se peut que le ministre Shephard va ajouter. On parle des gens qui ont sorti de la province, mais ils sont des citoyens du Nouveau-Brunswick. Ils ont voyagé, ils ont reçu leur vaccin en hors du province, mais quand ils retournent, c'est un citoyen du Nouveau-Brunswick. On veut les compter dans nos pourcentages. Ils sont ici maintenant et ils ont un vaccin. Mais s'ils ne l'ont pas reçu ici, ça veut dire que ce n'est pas enregistré c'est pas inscrit dans notre système. Alors, pour avoir les nombres de la population qui sont vaccinés juste, il faut les inclure, il faut leur inclure. Merci, Dr. Russell.
Merci.
Good.
Hadil Ibrahim, CBC.
Thank you. For Minister Shephard, you said you're confident we will get to 75% by June 7th, but do you have a plan if we don't? If yes, can you describe it? So will we have a news conference every day, or will the date be moved by a certain number of days? How would that work?
Well, I don't think that we've delineated exactly what it will look like if June 7th doesn't happen, but I think that, you know, New Brunswickers understand the importance of this, and I believe that they will step up, they will help us achieve our goal. If we don't, I don't think it would be far off the mark of June 7th. So I believe that, you know, we'll just watch it very, very closely, but, you know, I'm quite confident we're going to get there.
Ms. Ibrahim, do you have a follow-up?
Yes, also for Minister Shephard, are we anywhere closer to knowing how you plan to verify that a traveler has been vaccinated?
Travelers would have received their vaccination records, of course, at point of vaccination. And so public safety is working on a plan for you know, confirming that data. And we'll have more to say about that in the next day or so.
Thank you.
Thank you both. Lindsay Armstrong, allnewbrunswick.com. Lindsay Armstrong. Lindsay, I believe you're online. We can't hear you.
Does she want to type her question?
Do you want to type your question in quickly, Lindsay? We have a few minutes left. Go up there. Here. Okay, thank you. Mesdames et messieurs, ladies and gentlemen, that concludes today's update. Merci beaucoup. Voilà la fin de notre mise à jour. Merci beaucoup.